I'm here to draw insulin, and I have assembled my materials. I have 1 ml syringe of insulin with a 29 gauge of the needle. I have my insulin, short acting, intermediate acting. I have gauze, and I have cream gloves. So I will first confirm the medication and the physician orders. The order says give 4 units of short acting insulin and give 8 units of intermediate acting insulin, and that's what I have. So the order is tallies with my record. I'll then go ahead and confirm the 6 lines of medication administration, which is a light patient, light drug, light dose, lab time, light route, light documentation, and then I will compare this with the EHR, and that tallies with my record. Give 4 units of short acting insulin and 8 units of intermediate acting insulin subcutaneously every morning before breakfast. That's what I have on the EHR. I'll then go ahead and approach my client. Good morning, Mrs. Smith. My name is Valentine, and I'm here to provide you your medication. It's a good time. Okay, then I'll provide privacy, perform hand hygiene. And Mrs. Smith, may I use your list pad to confirm your name and date of birth? That tallies with my record. So, do you have any allergies to food, medication, or any other seasonal materials? Okay, so then I'll go ahead and perform hand hygiene and don't cream gloves. So Mrs. Smith, the reason why I'm here is because I have your insulin, and the reason for giving you insulin is for management of diabetes, type 1 and type 2 diabetes. And when we're giving this medication, we give because it helps change the way your cells, it helps by making your cells in the reabsorption of glucose from your blood to the cells, hence reducing the amount of glucose in the blood. And when you're doing this, you may experience some redness, some swelling, some itchiness, and maybe some headache when we administer the medication or side effects. And you may also experience some burning and stinging sensation when we are administering the medication. You may also have some rash, itchiness, constipation, weight gain as adverse effects. And if you notice these, please let me know so that I can take appropriate measures. So I'll have the nurse confirm with me that the medication that I have here is the medication that I'm supposed to give. And in this case, I'll be giving 12 units of medication, 4 of short acting and 8 of intermediate acting insulin. So the nurse has confirmed with me, so I have the right medication. So I'll go ahead and roll it on my palms for consistency. And then I'll go ahead and clean on with a clean alcohol wipe. I'll clean. Being careful not to introduce new germs or all that. Then I'll go ahead and with 1 ml syringe, I'll go ahead and do 8 units of air. So I'll go ahead and do 8. Units of air, and that I'll use on the intermediate acting insulin. And I'll be careful not to contaminate the needle with the intermediate acting insulin, so I'll not go all the way deep. So I'll inject the air to to the intermediate acting insulin. Remove them and then do 4. And I will go ahead and inject this in the short acting insulin. Inject the air, invert the vial, and draw 4 units of intermediate insulin, in short acting insulin. I'll be careful not to have any air in there. Make sure there's no air. And I have 4 units. And then go ahead and have 8 units of intermediate acting. So in that case, I'll mark where my 12 mark goes to, because I will not be able to return the insulin back to the vial after I withdraw whatever amount. So I need 12 units, and I need to be very specific on this. So I'll use my 10 mark. 10. Yep. I need 12 units, and that's what I have. Yep. I have 12 units. So I will go ahead and administer this to my patient. I have 12 units of my medication. So I will go ahead and administer that to my patient. I will put this in the sharps. I'm not going to recap. I'll just engage the security feature. I'm not going to recap. I will not massage the area, and I will confirm before giving the medication. I'll confirm that I have 12 units, and I have the same amount of units in the AHL is what I have on the syringe. So, and then I will remove my gloves, perform hard hygiene, and document.